Houston is a great city.
It's an opportunity city where people can find employment, where they can gain the skills to be successful.
Houston is a great place, a growing community, and I think we all have a responsibility for the well-being of our community.
People like me who come to Houston just fall in love with it. However, we do have challenges.
We rank 47 out of 50 states in terms of the ratio, the number of primary care physicians per population. Surrounding the Texas Medical Center are geographic communities that have major health disparities and health indices that are sometimes in some places similar to those of third world countries.
We have plenty of specialists, some of the top in the world, but really to be able to have a program focused on primary care, to really teach that broad base net that we need to support our community is essential. Only about 20% of medical students that graduate go into primary care. So when we think about this world of being more about preventative care, about managing chronic illness, that needs to be done largely by primary care physicians.
I think everybody agrees in Houston there is a gap. Who's going to step up and fill that gap? We are the largest public university in Houston. We will need to have a medical school.
The mission of the medical school is to improve health and healthcare in communities that have major health disparities. And to do that by training a new breed of physicians, physicians who understand health disparities and their causes. All physicians should have solid training in mental and behavioral health. We partnered with HCA Houston Healthcare. HCA Health is not only the largest hospital company in America, but they're also the largest hospital system within the greater Houston area. We need a hospital partner to train our medical students and our future residents.
I'm a huge supporter of this for many reasons. I represent 60 institutions, and many of them are leaders of medical schools as well as hospitals. They see this as extremely complementary to the existing hospitals and medical schools that exist today. University of Houston has always been innovators in so many ways. Thinking about designing a medical school for the future, population health is the cornerstone for that mindset, meaning that you can't just treat patients when they come through the door in the clinic. You need to manage them remotely. And so I think the opportunity that University of Houston has is to really design an entire medical school around many of the technologies that are here today.
The Greater Houston Partnership is the voice of the business community. When someone is thinking about moving a business to Houston, they'll ask a number of questions. They'll ask a lot of questions about just the general economy and the policy environment. Is this a good place to do business? They'll ask questions about the educational system here, education opportunities. And then the third thing on that list typically is healthcare. There's a greater concern today among employers that the overall state of Houston's healthcare system is not what we need it to be.
I think healthcare is right up there with, at the top of the spectrum is people want to know when they come there, what are my healthcare options?
I think of the University of Houston as being an ideal proponent of focus on primary care, a focus on health care for the urban setting as well as the rural setting, because that's kind of where University of Houston has always been. It's always found that balance between quality and access.
That's what UH does. It reaches out and it strengthens our entire community. We have to lead, we have to set an example that we care about people, because at the end of the day, whatever business we're in, whether it's education at U of H, whether it's petroleum business, furniture business, we're all in the people business. So if we can care about our people and our citizens, then we have done something right.
The University of Houston over the past decade, it is becoming a mecca for some of the top talent in the world. It is a natural progression of a medical school. This is really a step to the future. This is the beginning of what I think many medical schools will do, is really build a much broader base of primary care physicians, because that's what our community needs. So when we think about this investment, this is an investment in our future that will pay huge dividends.
My appeal to anybody who's listening is come and be part of this journey. Come and be part of this dream. Come and build a city for tomorrow.